My name is Grant Mitchell. My background is I have an MD and MBA from Penn, and had the pleasure of going through the educational process with David Fagenbaum, who is the director of the CDCN.
Great. What's your role within CDCN?
I'm director of strategic partnerships, helping strategize around how to organize the research effort, not just on the scientific side, but logistically how we're going to partner with players like Janssen and Penn in order to actually bring the research forward.
Is that common for nonprofits to act in this way, strategically, collaboratively? What's the CDCN doing differently?
So I think it probably is on a larger scale if you're thinking of like breast cancer research, the Castleman Foundation, and whatnot. But as far as rare diseases go, this is rare in and of itself because usually the landscape is extremely fragmented, both in the researchers, the clinicians who see maybe only one patient in their entire career, and then the patients themselves who have a lot of difficulty in finding each other. So finding one organization that has bridged those three entities, the researchers, the clinicians, and the patients themselves, is extremely valuable and rare in the rare disease space, and it's allowing for research and community to build faster than it ever has before in the Castleman, for Castleman disease specifically.
So you got a chance to meet some patients at the Patient Summit on Friday. Were there any stories or were there any themes or things that you noticed from that meeting that you'd want to share?
Yeah, so I mean, just kind of, I'd like to echo a little bit what I said previously about the patients being in silos themselves because of the rarity of the disease, and for a lot of them, seeing other patients like them for the first time, not just communicating on message boards online, but coming together in person and being able to share their stories verbally with each other was, for me, is very powerful just to watch. But I could look around the room and see how it was powerful for the patients and the loved ones of those patients in the room. I think one of the coolest examples of patient engagement in the community right now is the fact that we have multiple people now are getting the Castleman tattoo on their bodies, which is that's kind of the ultimate show of patient engagement.
So as someone who's helping with CDCN strategy, if you had $1 billion or could do anything, what would you say are like the most important things that we have to go after?
So some of the things that need to happen immediately don't need $1 billion, and that's the beauty of what's happening right now, is that there's a lot of low-hanging fruit in order to accelerate the research, and a lot of that is what's happening with the CDCN, which is simply organizing and orchestrating the research amongst the experts who were doing this individually, but now coming together and prioritizing what needs to happen going forward. What we don't need money for, but we simply need engagement with, is the patients themselves advocating for themselves. So what you can do as a patient is you can register with the CDCN on the patient registry, which is in development, and you can advocate for yourself with your clinician to submit your samples, your tissues. This is what is going to be used to do the research. If the patients don't do that, then there's nothing to study and there's nothing to develop new drugs and therapies for.
And the last question, tell me a little bit about the registry. Maybe you can tell me about the model or what you think it's going to do for the communities. Anything you like about the registry?
Right, so the registry also is unique in that it's drawing information from multiple sources, from not just clinicians but the patients themselves. Patients can go online and input their medical information and allow the CDCN to have access to that, so we can track over time what's happening with the progression of the disease and give us greater insight than we could ever have before without that patient engagement. And it'll be a very powerful tool in understanding the disease going forward.
Awesome. Thanks so much, Grant.
Thank you.